I'm happy because I've sat here and I know how lonely and uncomfortable it can be.
Coming up today, happy to be giving back. This woman living with cancer is pursuing her passion and using her art to brighten up her doctor's office. Good morning, I'm Jessica Lovell, and welcome to the Morning Medical Update. The woman we're about to meet today would really rather be traveling, but a rare form of cancer, sarcoma, threatened her ability to get out and get going. Angie Racono shows us this woman living with cancer isn't just traveling these days, she's bringing back some really incredible photos.
You can't help but appreciate how incredible a place we live in.
Ginny Curtin calls her travels her happy place, and she's been everywhere, documenting the beauty and the drama.
This is one of my favorite. This is Mama Cheetah to the left with a youngster.
Flowers can be ordinary, but zoom in for the extraordinary.
I think this is the action. The colors are such that it looks like it's on fire.
All of this depends on finding perspective.
You're looking for the beauty and the ironic twist of, oh, there's a frog underneath that lily.
Ginny shares her photography with patients at the University of Kansas Health System. The photos change as she travels.
About every 3 months, she brings me a new set of pictures from her travels around the world, and we really enjoy it. Patients do too, they comment on it all the time.
Ginny understands what it's like to sit in the chairs and wait and possibly get tough news.
There were some days early on that were very bleak, but not so much anymore.
Ginny will tell you she doesn't like chairs.
I'm not going to be the best patient if you make me stay at home and sit in a chair all day. It's not good for me.
She needs to live her life, and her care team supports that.
So in my mind, I play hard and live hard and have fun, travel for 6 months, and then I come back and go through scans and we do it again.
At one point, Ginny learned she had just 18 months to live.
I'm here today to tell you that was over 6 years ago. So it's just been blessing on top of blessing. And so I'm happy to help any way I can.
She shares her spirit of adventure, her artwork, and she plans to leave a legacy behind to the Sarcoma Center, emphasizing the importance of quality care close to home.
I have 100% faith in this group. So, no, I don't need to go any further. They're in my backyard.
And we're so glad to welcome Ginny to our studio this morning. Thank you so much for joining us. How are you?
Good morning. It's great to be here.
It's so great to be here. I'm just really enjoying the story so far and looking at these beautiful photos.
Thank you.
We're also joined by this guy, Dr. Howard Rosenthal, an orthopedic oncologist and medical director of the Sarcoma Center here at the University of Kansas Cancer Center. Always great to have you here in studio with us.
Thank you very much.
You usually work out far away from this main hospital, but I think you wanted to come down here to be next to this lady today.
Absolutely, and I do have to apologize because my eyes, I think, are watering up or tearing because of that intro and looking at those photos and remembering that time.
It's okay that you're leaking today. That's okay. We like that. And across from me today and working alongside Dr. Rosenthal at the Sarcoma Center is Kim Haynes, clinical nurse specialist. Kim, how long have you been working with Dr. Rosenthal?
I've been working with him for 33 years.
How's that been?
Yeah.
Well, yeah, 33 long years. Yeah.
That's a long time. I mean, what a partnership that has been, I bet.
Well, I met him when he was our orthopedic resident, and I was a staff nurse on the orthopedic unit. And then when he came back as a staff physician, about 9 months later, he was looking for a nurse, and I said,
You're the one.
Yeah.
What a partnership. I love that. Both Kim and Dr. Rosenthal happen to have known Ginny before her sarcoma diagnosis, and we're going to get to that story here in just a moment. But I want to go back to the original diagnosis. Ginny, a knee replacement helped save your life.
Yes.
Tell us about that.
I had knee pain for a number of years, and my background was in outpatient physical therapy, and I knew the time was coming. And so I was working with an orthopod that we were all set, and I had the one knee done. We knew we were going to have to do both knees, and I had it had it done, and I would continue to run into that physician, that surgeon, at the gym, and I was so happy because the pain was gone. It was so much better. I could function better. And so I was jumping at the gun to go ahead and get the next one. And he said, no, Ginny, you got to wait for your 6-month checkup. So that day came, and we were there, and we were actually in the midst of scheduling the surgery. And I said, hey, would you mind taking a look at my left hamstring? And we had known each other for 20 plus years, and so it was very informal. And he said, sure, and hop up on the plinth and palpated my left leg and said, you need an MRI. It won't tell us anything. It's going to need to be biopsied, and I want Howard to do it.
Because they found a bump.
Yeah.
A bump.
There was a knot there. Not painful, you know, it just was a knot. And I looked at him and I said, Rosenthal? And he goes, yes. And so that very informal relationship became very businesslike. And I was fortunate enough to see Howard in the next 24 hours, and life changed.
Okay, because he mentioned the name Howard Rosenthal. You knew
Yes.
the name.
Yes.
How did you know each other before?
Dr. Rosenthal does amazing things. I've been able to observe some of his surgeries and take care of some of his patients. And so we had a professional relationship dealing with those patients for a number of years, never dreaming that I would be one of his patients.
That was a really great catch then, I guess,
Yes.
Dr. Rosenthal.
Yes.
By her orthopedist. What could have happened if they would have maybe just brushed off that lump and maybe didn't catch that? What could have
Right, it's a very good question, because that's one of the biggest problems with regard to sarcoma. They typically don't cause significant symptoms, so the patients don't present to the hospital or to the doctor. It would have grown, it would have invaded into other structures and then spread through her blood system into her lungs, and that could ultimately cause death.
Because a lot of times people kind of do the whole wait and see routine, right?
Correct.
Let's see if it grows, let's see if it gets bigger. And this is one of those cases you can't wait.
Right, and that's exactly what most patients say, is it didn't bother me, so I didn't go to the doctor.
Because Ginny said it didn't hurt.
Exactly.
Never heard. Never heard.
Okay, good to know. There are also different types and subtypes of sarcoma. What was Ginny's original diagnosis?
So her original diagnosis was one of the sarcomas called myxofibrosarcoma. There are about 80 different types of soft tissue sarcomas. If you add them all together, they still represent less than 1% of all cancer. So we're talking about very, very rare cancers. Hers was myxofibrosarcoma, which is not in the top 5.
Kim, before you ever saw Ginny as a patient, what was your relationship like?
Well, she would come to our office and talk about the physical therapy group she worked with, and so we knew her, and she's, as you can tell, how bubbly she is. So it was always fun when we knew she was coming in to talk with us.
Well, when you already have a connection with a new patient, does it feel different working with them, and or what stays the same? What's different and what's the same when you already have that connection established?
Well, the nice thing is that we knew each other, and so that made it easier in some parts. The hard part was that Jenny knew what we did, and so I knew she knew, that it was concerning and that she had a life-threatening disease process.
Let's talk about treatment. Ginny needed about 40 radiation sessions to kill the tumor. You remember those?
Yeah.
Okay, then Dr. Rosenthal went in to cut it out. How were you able to remove the tumor, Dr. Rosenthal, but also protect Ginny's ability to walk? She's a big traveler, so
Sure.
that had to be front of mind.
So that's what I consider the art of sarcoma surgery, is on the one hand, we have to take that tumor out in a wide en bloc fashion. What that means is with a cuff of normal tissue surrounding it and in one piece, so that we don't spill any cancer cells. At the same time, we have to preserve the structures, the nerves, the muscles, the blood vessels, the bone, the ligaments, that will allow her to do the activities that she likes to do.
Yeah.
If the tumor touches one of those tendons, again, wide en bloc means we have to take it out with that cuff of tissue. If that cuff of tissue happens to be the tendon, it has to come back. So if that's the case, then we do reconstruction, we do muscle transfers, we do vascular bypass. There are a lot of techniques that we have.
And Ginny, of course, surviving is one thing. Got to do that.
Yes.
But as we saw in the piece, sitting in a chair, in a recliner, that is not for you.
No.
How much work did you put into physical therapy?
Well, that's my background. So I knew it was coming, and to me, it was all about getting back to function. Whether it was the ability to walk and balance right off the bat, that was important. You know, being able to walk the dog every morning, that was a big hurdle. And just then gradually going up to the point where I could get in and out of a Zodiac in Alaska so that I could go back to doing what I love.
Well, on that note, where was your first trip after surgery?
Actually, it was back to Alaska. Yeah. We, a group of us, about 8 friends that are photographers, had been going for a number of years, and we basically live out on a boat and are with the bears. And so that was the strategy to get back for that trip. And
these are not postcards, I have to be clear. These are pictures you've taken. They are so incredible.
Thank you.
Beautiful,
Thank you very
beautiful.
much. Yes.
So this was your first trip after surgery, but after that trip, you got some bad news. How did you learn that the cancer had spread?
That was the ironic part. On that trip with those close friends, they were working because they all knew it was the first trip back on my persuasive speech that I needed to be able to come back to talk to both Dr. Rosenthal and Dr. Powers and say, I'm good, I can travel, let's go. And I knew I was coming back to scans. And sure enough, something came up on the scans. And so I got the phone call from Dr. Powers, and he said, I need to see you. And they had realized that there was a mass on my right chest wall that had appeared.
And you were given a prognosis counted in months, 18 months at that time, 6 years ago.
They resected it very quickly, and then we followed that up with some radiation. But I'll never forget the day when I was visiting with Dr. Rosenthal, and he said, Ginny, I never say never, but I've never seen it cross the midline of the body before. And so at that point I knew, okay, we're into a different world now. And
well, in fact, you actually said Rosenthal has seen it all. That's something you had said, but Dr. Rosenthal, you said you had not seen anything quite like this. What made it so unique?
Right, so we understand the mechanisms of myxofibrosarcoma and most sarcomas, how they behave, how they travel, how they metastasize through the blood system. But going from the back of the left knee area, the back of the left thigh, to the right axilla, the armpit chest wall area, doesn't make sense from an anatomical standpoint. The vessels just don't do that without having pulmonary or lung disease. So that's extraordinarily unusual, and we still don't understand that. I actually have seen this several times. Thank you very much. And so we understand that it absolutely exists, and we have to treat it very aggressively. And that's what I would think if I were to say one thing for patients, is diligence in monitoring. Okay? Yeah. She wouldn't have found out about this had it not been for our routine sarcoma surveillance. And we look for the unusual. I mean, we're dealing with a cancer that is so rare. There's no, this is what 1,000 people are subjected to and so forth. So we have to be diligent about our follow-up.
Ginny, are you taking maintenance medication for the cancer?
And not really at this point. It's not something that we have a lot of medication. I mean, the usual, vitamins and just staying healthy. But no, it's as Dr. Rosenthal said, it's sticking to the schedule. And they have asked, and I am very willing that if something doesn't feel right, to call.
Right.
Smart. Okay, so tell us about this schedule you do, because you need the scans and the checkups, and what do you do between the checkups?
That's when you live life.
I love that.
I try to enjoy life at that point, and just whether it's traveling or photography or both or whatever it might be. But now, originally when we were going down through this journey, it was every 3 months. And so you kind of had that 90-day window. And then things stabilized, and now I'm at 6 months. So
that window's getting bigger and bigger.
I was going to say, it's a good thing. But I also know that at that point in time when that day comes for those scans and the follow-up visits, I need to be there. That's part of the whole journey.
And Dr. Rosenthal and Kim, it's like these photos represent what she's out there doing. And I mean, it represents her
Exactly.
living this beautiful life. So Kim, Ginny's bringing back all these beautiful photos, landscapes, the flowers, the wildlife. So who made the call to put these screens up in the Sarcoma Center and to display these cool photographs?
Well, we had the two screens, and we had some ideas of what we were going to do with them, and it just never kind of came to fruition. So the one in the waiting room just had a waterfall that just ran constantly, and every time Ginny came in with her photos, you know, we'd be like, wow. And then I don't remember if it was you or me or Doc said, you know, let's see if can't we run them on the two screens we have. And so we got that set up, and yeah, every 3 or 6 months she calls or sends me an email and says, I've got new photos.
Yeah.
And so
it's so stingy to be like flipping through a phone and looking and going, wow, these are so amazing, and not sharing them with the world.
Whether it's with Dr. Rosenthal and Kim or over at Dr. Powers, because I have to go there also, we kind of have a tradition now that, you know, I know from my appointments, I have to show up with my iPad. And the iPad goes on the table, and the doctors put their phones on the table, and we all talk about pictures and where we've been lately. And so it's this great time. And to me, it's part of the visit. The interesting thing is when we have residents, which we do in both places, come in and they've never seen anything quite like what we're doing, because I've been blessed that starts the meeting. You know, yes, the scans have had, but we're going to talk about good times, and then we'll deal, if we have to deal with the other part.
Now, I do have to interject. When Ginny is on the schedule to come in, we do have to give her 2 slots of patients.
I like that.
50% of the time is going to be for looking at the pictures.
I like that.
And I do thank her, because my original intent on the panels, the screen panels in the waiting room and in the exam areas, was to have surgical pictures of sarcoma events. And then I realized that might not be the best, so Ginny came and saved us from that.
Thank you. Thank you, Ginny. You saved us all from that. Because I was going to say, what do these pictures mean to patients? And I think you just answered it,
Yes.
Kim, especially when they learn where they came from. These are from a patient out living life and bringing back her experiences.
Oh, I mean, patients comment on them all the time, or they'll say, wow, those pictures are great. Who did that? And we're like, well, it's one of our patients, you know, and we're very proud. And I in fact even have one of her pictures in my office, one that you showed earlier, of a, I'm going to say it.
Stellar sea eagle, yeah.
Yeah, Japanese eagle?
Yeah, it was taken off the coast of Japan, but it's a stellar sea eagle. It's the largest eagle in the world.
Wow.
Yeah.
And so
I like to say, and I say it all the time, that our patients inspire us. Okay? Yes, we can do the medical management and so forth, but when the patient comes and is able to inspire us through photography, through art, through getting through a cancer that, you know, 20 years ago would not have happened. That's inspiring. And that helps me personally.
Keeps you going.
Yes.
Okay, so we could spend the whole time talking about all these photos, but we're going to narrow it down to one photo that we wanted to have you explain this shot in Alaska. Kind of what's the story behind this photo?
Well, when you go to Alaska to photograph bears, you want to go the first week of August, because that's when they change from sedging, or eating grass, to fishing. And so this image was taken in the Kenai National Park, Katmai, National Park, and this is a mama bear.
And how close are you? Can I just ask? Is this a super duper zoomed in lens, or are you close?
I was going to say, the lens is pretty good. I'm probably 30 yards. Okay. Not that far. The interesting thing in this particular bay where we're at, there's the tides. And the tide is lower, we can sit on a rock bar. And so we're there, and the bears are hungry. So they really don't care about us as long as we don't interfere with the little ones. And so August comes around and they know they have to start eating before hibernation. So it is fun, and it's almost to a point just like a college football game, because they miss more than they catch. And so you're cheering on as they come storming down the creek trying to catch this piece of
You're
salmon.
just watching
Yeah.
in like awe and respect of this, you know, in
and
their
they
environment.
try so hard.
Oh, I
and-
love
yeah.
I
yeah.
love that. That's a neat story. Thanks for sharing. We want to thank you all so much for sending in your questions and comments to our program. We love responding to those here in real time. So be sure to write us a message or a question on YouTube or Facebook. You can email the Medical News Network. That information is there on your screen. Where are you off to next, Ginny?
Costa Rica.
Oh, nice.
Yeah, I'm going back. I was there a year ago and fell in love with totally different landscapes, totally different animals, and I have an opportunity to work with a guide down there that I couldn't resist. So,
Does traveling feel different before diagnosis and post-diagnosis?
yes, there's a whole different level of gratitude now. I know how special it is to go and because there's preparation for this that wasn't there before. And so it's not just a matter of setting up the trip and doing the logistics of it. It's knowing that I can, that these are opportunities that I probably shouldn't have, but I've got them. And so to take advantage of that and live it. Yeah, thank you.
You mentioned, Ginny, the importance of local care.
Yeah.
What has it meant to you having this level of specialty care so close to home?
I am so blessed, so blessed. I have friends that are in when you have diagnosis like this, you meet others that have cancer, and they're flying all over the country. And that's okay because there are experts, but my experts are in my backyard. And so to be able to be at their office, know their staff at the front desk, be able to pick up a phone and call them, it's huge. And when you go through this, you need a team, you need a village. And so it makes it easier on your family and your friends also because you're here. You're not in Houston or Minnesota or any place else. You're here.
Peace of mind.
Yeah.
Dr. Rosenthal, what's new and hopeful for you in the world of sarcoma treatment?
So I've been privileged to experience the sarcoma world since essentially its inception as a specialty. And it's remarkable to me that over this past 30 years, how much we've been able to improve our ability to cure patients of their cancer, and in fact we are curing most patients with sarcomas now. But not only that, we cure them with preservation of their function, preservation of their limbs, preservation of their ability to go back to work, to enjoy life, and to experience things.
How rare are sarcomas that need this type of high-level care? I know you mentioned how rare and how you said 80 different types, but how often is it necessary for them to be in your hands?
Well, every sarcoma does need to be seen and treated, and preferably at a sarcoma center, a center that handles large volumes. There was a study done a few years ago that looked at what is a large volume of sarcoma for a center, and that number was, and I don't want to say the number, but it was over 1,000% less than what we see. Wow. So we see a lot of sarcomas, and as Ginny pointed out, there are not a lot of sarcoma centers in the country because of the rarity of the tumor. At KU, we happen to have a good sarcoma center. We have a very high volume where we draw patients from multiple states around the Midwest. And number one, I'm very proud of that. But number two, we get the privilege of being able to treat those patients.
Kim, what do you tell patients about hope when it comes to a tough diagnosis?
Yeah, I tell them that they're in great hands. I mean, Dr. Rosenthal is one of the most experienced orthopedic oncologists in the world, I will say, and I've had the pleasure of working with him, and I just say that you've got all these experts and you're at the best cancer center in the world, and we're going to take care of you, get you through it.
Yep.
Let's take another look at some more of your pictures before we get close to wrapping up. And while we show you those, Ginny, I want to ask you about your take on photography. You say it's using left brain and right brain at the same time. What do you mean by that?
The cameras and lenses that we have at this time are computers. And so we have to have that part of our brain that can be very rational and follow step by step what we need to do based on light or composition. But then there's also the beauty in the world, and it's the ability to capture that. And that's the treat of going and traveling, is to go to places where this beauty is incredible, and you have nothing close to home that's anything like that. So it takes both sides.
I want to get to some questions and nice comments from our viewers this morning. Mary has a comment. She says, she is amazing. I assume she's talking about you.
It's these two that are amazing.
I have been on my journey, this time for 7.5 years. I was treated at the Sarcoma Center in 2018 to 2019. I have received nothing but wonderful care. I agree with Ginny. Get out there and live your best life.
Yes.
Jeremy says, it sounds like depending on where it is and what has to be cut out, that recovery in physical therapy could be pretty unique for every person. For Ginny, on the physical therapy side, how do you know what to work on to return as close as you can to normalcy?
Well, that was the beauty of working with everybody on the Sarcoma team, is they knew my background. And so I could ask them nerdy physical therapy questions, and they would appreciate it where it was coming from. In fact, I'll never forget, at one MRI, the tech signaled me back, and we looked at the screen together, and we looked at the first picture of where the tumor was still in my hamstring, and it looked like a lemon. And I said it. I said, it looks like a lemon. But it gave me a visual of what then Howard was going to do. And so I knew where I was going to have to work, for example, on stretching and balance, and just knowing what wasn't quite the same and what could still get better.
And I think that's part of the success of our sarcoma story, is that we work as a team. Okay, that team includes, and I'm going to tell you in all honesty, it includes housekeeping in the hospital rooms that care for the sarcoma patients. It includes the dietary team. It includes the radiologists, where they know the types of x-rays or MRI scans that I will need to prepare for that surgery, the types of software to utilize for it. The physical therapist, we have to communicate with our physical therapist, because doing just routine total knee replacement physical therapy for a distal femur replacement, which is a much larger reconstruction, is different. Okay? The patient may not have the muscles, because I've taken them out, to be able to do that type of physical therapy. So communication across our team, I think, is one of the great features of our success.
Yeah, it's huge, because I can go in with a technical question, medical side, but I can also go in with the, okay, I'm a little anxious. Can somebody help me here? And what can I do to help calm my anxiety, for example? And there are people on the team that are there to help you with that. So all you have to do is communicate, and it goes both ways so easily.
We have a sarcoma tumor board, for example, that meets every single week, and it's attended to by about 30 to 32 healthcare personnel in our sarcoma world, in our sarcoma center. And part of what I enjoy about it is obviously the presenting the cases, what the expectations are, but challenging each other. Okay, this didn't work the last time. We have to use different chemotherapy. We may need to use different type of immunotherapy. We have so many different features for radiation nowadays that is different from what you had just 7 years ago.
Yep.
Okay, I've got a couple of nice comments. Alexis says she loves that you call him Howard. It makes it feel so much less stressful.
It happens to be my name.
I was going to say,
How coincidental.
informal, it's Howard. When somebody calls and says, where should I call? Dr. Rosenthal.
That's why I said I have to call him Dr. Rosenthal, but okay, it's Howard to you.
Yes.
She says when you're a patient and the doctor introduces themselves by their first name, it just seems that it's just so less stressful, so I think that's great. She also says these photos are phenomenal. Where can you see them if you don't want to go sit in Dr. Rosenthal's waiting room?
I was going to say.
Nobody wants to do that.
We'll put
so
bleachers up.
is there another place that you could find these photos?
They're on my website.
Okay.
Yeah,
Where?
GinnyCurtinPhotography.com.
Okay, fantastic. Jill says, what a great story of resilience. The passion for her photography equals the passion and love she openly feels for her medical team. So inspiring. One last question. Angie wants to know if sarcoma can be hereditary.
So no, the real answer is no. Now there are some extraordinarily rare hereditary type of syndromes that do include sarcomas. We do a very important family history to determine that. And if there is anything in the family history, it's almost like creating a 3-degree pedigree of the patient in order to determine, could this patient have a certain gene that may predispose them? Obviously that's important for the patient, but it's important for the family as well. And we have cancer geneticists as part of our team also that we will utilize in those situations.
Yeah. But I know
But the
in
right
our
answer
case,
is no.
yeah, in my case, there was no cancer in the family whatsoever. None at all.
Such a great conversation. Learning a lot this morning. Kim, what's the big takeaway from our conversation today?
I think the takeaway is just if you feel something that's different, then get it checked out, and then to go to a center that has just the multitude of expertise and experience.
Yeah. Judy, what do you want the big takeaway from your story to be?
I think Kim hit it, that if something's not quite right, to say something and to continue to communicate. And yes, this is an incredible journey to go through. There are times where you're going to be a little off your normal self, but keep talking to these people and keep fighting through it.
And from my standpoint, and realize I make people cry very frequently. I give them bad news. The greatest joy that I could have is a patient coming in, doc, I feel a lump, I'm worried about it, and for me to be able to tell them that's not cancer. So, like you say, recognition of the problem is probably the biggest part of the problem.
Yeah.
What else do you want people to take away?
Enjoy life.
Yep, live life.
And show the beauty of it.
Yeah.
You make people cry, but we made you cry today. Ginny made you cry this morning.
I cry a lot as well.
And we like that. And we
Yes,
like
we
that.
all do.
So great to have all of you today. Ginny, thank you for sharing your story.
Thank you.
And your beautiful photos. Keep
Thank
them
you very
coming.
much.
Keep traveling and keep those photos coming back.
Happy to. Yes, thank
all.
you.
Thank you all. Thanks to all of our viewers and your great questions and comments this morning. Have a great weekend, and we'll see you back here on Monday. Coming up Monday on the Morning Medical Update. We talk about fighting cancer, but Mark Slotnick says he had to surrender after his leukemia diagnosis. Nearly 20 years later, he's a fountain of knowledge for both patients and providers. I'm Jessica Lovell on the next Morning Medical Update. What it means to surrender, plus the healing that happens in a special support group from and for people with blood cancers. Monday at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcasts. Now, everywhere podcasts are available.